Hi, my name is Malavika Prabhu, and I'm a maternal fetal medicine physician at Weill Cornell Medicine. Thank you to the committee for allowing me to present our systematic review and meta-analysis on procalcitonin levels in pregnancy. Sepsis is a major cause of maternal mortality and morbidity. In non-pregnant individuals, procalcitonin may be useful in helping to both diagnose and treat bacterial infections. However, the impact of pregnancy, labor, and delivery on normal procalcitonin levels is not known, rendering uncertain the utility of procalcitonin to identify and treat maternal infections. We set out to perform a systematic review and meta-analysis of published literature to describe normative values of procalcitonin in pregnancy among healthy pregnant women and pregnant women with preterm premature rupture of membranes. We searched across several databases for any full-text English language study with numerical procalcitonin data. We included healthy pregnant women without comorbidities or women with PPROM. We stratified the data by labor status and clinical diagnosis. We had adequate data to perform the meta-analysis among the following groups: healthy pregnant women not in labor, healthy pregnant women in labor, and pregnant women with preterm premature rupture of membranes without chorioamnionitis and not in labor. We used a random effects model and report means and 95% confidence intervals. We used the Newcastle-Ottawa scale for quality assessment. From an initial 1,064 studies, we included a final 17 studies in the meta-analysis. Procalcitonin data from 565 healthy pregnant women not in labor were available for analysis. The mean procalcitonin level was 0.048 nanograms per milliliter with a 95% confidence interval of 0.04 to 0.056. Data from 170 healthy pregnant women in labor were also available. The mean procalcitonin level was 0.137 nanograms per milliliter with a 95% confidence interval of 0.064 to 0.209. Data from 345 women with preterm premature rupture of membranes without chorioamnionitis and not in labor were available. The mean procalcitonin level was 0.085 nanograms per milliliter with a 95% confidence interval of 0.06 to 0.110. Regarding our quality assessment, 41% of the studies were of good quality. This is a graphical representation of the meta-analysis for procalcitonin levels among healthy women not in labor, where the mean is 0.048 nanograms per milliliter. Here is a graphical representation of the meta-analysis for procalcitonin levels among healthy women in labor, where the mean is 0.137 nanograms per milliliter. Finally, here is a graphical representation of the meta-analysis for procalcitonin levels among women with PPROM without chorioamnionitis and not in labor, where the mean is 0.085 nanograms per milliliter. In summary, procalcitonin levels in healthy pregnant women are low, but almost double in labor. Procalcitonin levels in women with PPROM without clinical chorioamnionitis or labor are also low. Our findings suggest that procalcitonin levels may not be altered during a healthy pregnancy, and typical thresholds of procalcitonin values, which range between 0.2 to 0.25 nanograms per milliliter, may be valid to manage bacterial infections in pregnancy. However, it is important to note that the upper 95% confidence interval limit for procalcitonin levels among healthy women in labor was greater than 0.2 nanograms per milliliter. Limitations of our study include incomplete characterization of procalcitonin levels during labor stages, delivery, or postpartum, as well as women with preterm labor or clinically diagnosed infections. Further work is necessary to characterize procalcitonin levels during delivery and postpartum in order to understand appropriate threshold values after the onset of parturition. Additionally, prospective studies will be necessary to inform the impact of procalcitonin-guided evaluation and management of bacterial infections in pregnancy. I'd like to thank my mentor, Dr. Melissa Bauer, and my collaborators on this study. Thank you again for the opportunity to present our work.